I'm Dr. Coleman Martin, a neurointerventional specialist at the St. Luke's Brain and Stroke Institute in Kansas City, Missouri. This is Interventional Stroke Rounds. Today we have a woman in her mid-30s who presents with 3 transient ischemic attacks, otherwise known as TIAs or warning strokes. During her first attack, she was teaching and was suddenly unable to understand what a student was saying to her. During another attack, the upper half of her vision of her left eye went black. During the third attack, she experienced numbness of her right hand. The fact that each of these attacks lasted only a few minutes makes them no less dangerous. Our patient was referred to a neurologist who ordered a MR angiogram. This scan showed severe blockage of the left carotid artery. There was also partial blockage of the right carotid artery. Our patient was urgently scheduled for a conventional catheter angiogram to better define the anatomy as a necessary step towards treatment. After a local anesthetic, I introduce a small catheter into the right common femoral artery, advance it up the aorta, into the left common carotid artery. The catheter is used to inject contrast into the artery, which allows the artery to be seen under X-ray. Now, while injecting contrast, I spin the X-ray camera around our patient. This image is fed into a workstation which creates a 3D model of the blood vessel. Let's zoom in on the blockage. This blockage is very severe, over 95%, and involves the common carotid artery, a vital source of blood to the left eye and the left side of the brain. Fixing this blockage will greatly reduce her chances of having a stroke. Traditionally, blockages of the carotid arteries have been fixed surgically. My father had both of his carotid arteries fixed surgically, leaving the telltale scars on either side of the neck. Our patient is not a good candidate for carotid endarterectomy. During her teenage years, she was diagnosed with lymphoma. Her cancer was successfully treated with surgery and radiation therapy to her neck. In fact, this radiation therapy caused scarring of the carotid arteries, leading to the blockages that we see today. As an alternative to surgery, we're going to treat her carotid blockage during her angiogram procedure. A balloon will be used to angioplasty or stretch her artery back to the normal size. Once the artery is open, a stent will be placed inside the artery to maintain the normal diameter. The stent is delivered to the blockage collapsed inside a catheter. The stent is made of a nickel-titanium alloy called nitinol. Nitinol is used for its shape, memory, and elastic properties. Once released from the catheter, it unfolds and props open the artery. Carotid stents are flexible, durable, and don't corrode. Before angioplasty and stenting, a small filter would be placed inside the artery to catch any debris or clots dislodged during the procedure. I'll show the X-ray images of our patient's carotid stenting procedure. To clarify what we are seeing, I will superimpose video images of some of the devices. Let's look at the blockage again. Here's the point that we must open. There is a lesser blockage here, too, which we will also open. The blockages are affecting the brain. There is minimal blood flow inside the skull. While our patient is under sedation, I pass the filter beyond the blockage and deploy the filter in the upper internal carotid artery. With the filter in place, I am advancing the balloon over a wire up to the blockage. I inflate the balloon and angioplasty the blockage. An injection of contrast shows improvement in the blood flow. Now I pull the balloon down to the lower blockage and angioplasty again. I remove the balloon and deliver the stent to the upper blockage. A quick contrast injection lets us check the placement of the stent before releasing it. The stent unfolds from the delivery catheter and holds the artery open. Now I deliver a second stent to the lower blockage. I slightly overlap the second stent with the first stent, completing the reconstruction of the artery. The filter comes out, and now we see that the blood flow to the brain is restored. At her 6-week clinic appointment, our patient is back to normal. Just before her 6-month clinic appointment, she began experiencing episodes of blurry vision in her other eye. An ultrasound scan showed that the blockage of her other carotid artery had worsened. She came back for an angiogram. This time I will show the right carotid artery. While not as bad as the left side had been, some views of the blockage show it to be more than 70%. Also, blood flow to the brain is being compromised. Just like the other side, there are 2 blockages right next to each other. This time they're close enough that I should be able to cover them with a single balloon and stent. Using the same steps as before, first I pass a filter across the blockages. The filter is deployed in the upper carotid artery to catch any debris that might be released during angioplasty and stenting. Now I cover the blockages with the balloon. This is how angioplasty balloons are pressurized. Of course, during stenting, everything is done with surgical gloves and sterile technique. An injection of contrast shows us that the blockages are improved. The balloon comes out and the stent goes in. Now the right side looks as good as the left. To remove the filter device, I collapse it into a catheter and carefully pull it through the stent and out of the body. A check of the brain arteries shows that everything is flowing well. In the end, we were able to treat both our patients' carotid arteries using neurointerventional techniques with nothing more to show than 2 1/4-inch scars at the groin. With both carotid arteries repaired by stenting, I expect our patient to live a normal, healthy life. I chose this case because it illustrates the importance of paying attention to neurological symptoms such as numbness, weakness, loss of vision, or problems with speech or language. Had our patient ignored these warning signs of stroke, I believe she would have gone on to experience a severe stroke. If you or a family member is experiencing warning signs of stroke, please see a doctor immediately. If you live in the Kansas City area, remember, St. Luke's Hospital has neurologists and neurointerventionalists available day and night. I hope you found interventional stroke rounds interesting. At St. Luke's Hospital, we're committed to stroke and interventional education. Feel free to share this video on your blog, Facebook, and Twitter. Another stroke, gotta go.